Cosmetic Surgery Forum was really started by Joel Schlessinger, and this is the 11th year of the meeting. This meeting has moved from Las Vegas now to Nashville, and Joel has done a tremendous job over the years of putting together this meeting. I know he has wonderful help from his wife, Nancy, and he's got a team of Natasha and Meg and a whole cohort of people that really help him put this together. But it is a tremendous amount of work. And when you talk about starting a meeting and continuing a meeting with 11-year tradition and keeping it fresh and keeping it fun and scientific, how have you managed to do all of that?
It's the faculty. It's people like yourself who come here and take time out of their busy schedules to educate the next generation of dermatologists. So, Joel, you know how incredibly hard it is to take time out and to bring yourself to that level and make sure that you include interesting and factual data. And I just love your talks too. Your talks intersperse practical and analytical so fluidly. It's amazing. You know, you'll be starting to talk about something and then the reference will appear right there and you'll say, oh, and then there was this article in JAD. You must have a photographic memory or something.
I don't know about that, but in terms of some of the content that's at this meeting and the way that you devise sort of the overall program and the agenda, it really flows so well, and I think people really come home and they take home a lot of pearls.
That's the idea. So I want to have something where people do take something home. I want to make it so that it's interesting, kind of like what you had during medical school. Assume your medical school is interesting, but the most Socratic lecture that you had, that's what I want this to be.
And Joel, I mean, from all the things you do, from this meeting to Lovely Skin to running a practice, and I mean, huge, huge things and accomplishments that you really, as a family, I know, look at. But now you have a son going into dermatology. Daniel is a dermatology resident, and that must give you like a tremendous sense of pride that he saw you growing up and said, I want to be like Dad.
Well, in many ways like yourself, you know, it's the second generation, generation 2, and I think that that's great. The generation after us will only be better, I think.
So, we've talked about some of the practical points from the content here, but what are some of the things for you moderating all these sessions are really thinking about after this meeting?
Wow, there were a lot of sessions and everything was so interesting. Today, I found it really fascinating about the inclusion and talking about certain different populations that we serve, whether it's, of course, skin of color, but also LGBTQ, also transgender. You know, the idea that we have people that we're serving that aren't being taken care of in the normal manner, and we really have to approach them in a way that they can come to us and feel comfortable coming into our offices. I thought you were great. You talked about one of those patients that you were working on, and I thought that was an excellent point.
Thank you. I mean, we've really touched on so many different types of dermatologic issues, aesthetic issues, emotional issues, and then some of these issues related to sexuality. You've covered intimate aesthetics really well at this meeting. There were some really interesting presentations by David Goldberg and Doris Day talking about these areas. And I literally heard you at the podium. You even talked about the people who may, from a dietary standpoint, not have exactly what they want. Come talk to you if you're vegan, if you're vegetarian, if you're kosher, if you got gluten. I mean, you think of it all, and thank you for the attention to detail that you put in this meeting.
Thank you. Thank you so much. I appreciate it. Well, and thanks for your contributions, Joel.
Thank you. And thanks for joining us for DermTube meeting coverage from Cosmetic Surgery Forum.